completed my MBBS course from GMERS Medical College, Valsad, Civil Hospital, Valsad, and I have done my 1 year housemanship in the same Civil Hospital, Valsad itself. Sir, after my MBBS, post MBBS, I have done 1 year of bond in PHC Tutarkhed, which is situated in Taluka Dharampur, District Valsad, for a period of 1 year.
Yes, good. So, how you manage pre-interview nervousness?
Sir, I try to be confident, sir, and I try to give my best and I try to stay calm and relax.
Okay. Yes. So, can you please show the document you have brought for the verification?
Yes, sir.
So, how you organize these document? What is the sequence? Which certificate you have or documents you have?
Sir, I have my GPSC form. Sir, I have my MBBS mark sheets of first year, second year, third first, and third second. Sir, I have my GMC registration certificate. Sir, I have my MBBS degree certificate.
Yes.
Sir, and I have my Sir, and I have my for my birth date proof. I have my 10th standard certificate mark sheet.
Yes. So, you also need the interview call letter and the GPSC application form.
Yes, sir.
Yes. So, what motivated you to pursue the government medical officer in the Gujarat?
Sir, what motivated me was after my MBBS, the 1 year of house bond service which I had done. Sir, that gave me a lot of motivation because I was in a very peripheral area, sir, and I had after serving the people, sir, I felt a lot of gratitude from them, sir, and at the end of the day, sir, I had a huge satisfaction by doing welfare for the society and for those people, that which motivated me to give this GPSC exam.
Yes. So, can you please tell us any of the one weakness you are currently working on?
So my weakness, which I'm working on right now, is trying to not get very much indulged in with the patient. So because like if they are not able to connect, then I go to their home. If they are not able to come to my OPD, I personally go to their home and for take their follow up.
Yes. But as a medical officer, you have
Yes,
authority. You also have the staffs, so you can also mobilize your staff to their home visit. As there
yes,
is
sir.
a ASHA worker, there is a NM under you, nursing officer. So you can also use that community health worker in this work. Yes, so this
Yes, sir.
is a good performance on your weakness. Now, so if we ask your patient about you, what do you think they would say?
Uh, Sorry, sir, didn't understand the question.
If we asked your patient about you, what do you think
Yes.
they would say?
Sir, according to me, sir, I believe my patients will definitely say that I am very much disciplined. I come to my OPD on time, sir, and I stay till the and I help them in explaining their disease. Though they are from a rural area, they think that they are illiterate and they will not understand what is their condition. Still,
Yes.
I try my level best to make them understand what is their condition and the medications that they have to take, and proper counseling about what are the pros and cons.
Yes, good. So how do you explain diabetes to a illiterate patient?
Sir, like in Gujarat, sir, we tell that
Yes, you can
sugar.
use your regional language.
Yes. Yes, sir. In regional language, I explain them that there in our body there is the sugar level is there. So that is comparatively the range I say them. It should be fasting 126 and 140, and your level is high. So for that you have to take medications, and if you don't take medications on time and you don't control your diet and do proper exercise, and if you don't mobilize yourself and decrease and take the appropriate precautions, then in future I explain them what are the complications and the need that in future you might have to get admitted, you might have to take insulin also. And I tell that if you keep it in control, then you will have a hassle free life ahead.
Yes. So you can also tell about the diseases that this is due to deficiency of the chemical that is known as the insulin in your body, because
Yes,
patient
sir.
misconception that only eating the high sugar content is a causative agent for the diabetes.
Yes, sir.
Yes, everybody is eating the sweet food, but not all having the diabetes. So there is a
Yes.
pathophysiology also behind this. So how do you approach to counseling for lifestyle changes?
Sir, mostly, sir, I will tell them to go for a walk or a jogging according to the age of the patient. Sir, if they are high BMI patients, then I will say them to do exercise. If they are not able to do outdoor, then they can do exercise indoor also. So then I will ask them, then I will suggest them a proper diet also, that they have to eat protein rich and less carbs diet, less fatty foods, and what all they have to avoid in diabetes, sir. And also I will tell them to take the medications on time and have a proper sleep, and not to take much stress, and to follow a disciplined lifestyle that will very well help them in controlling the sugar levels.
Yes, good. So how would you react if a patient refuse life-saving treatment?
So for diabetes,
No, how would you react if a patient refuse life-saving treatment in your OPD? Any
sir, if
life-saving
a
treatment?
Sir, there have been incidences when the patients have refused due to the fear of the procedure. Sir,
Yes.
at that time, sir, what I had done was the patient's relatives who were there, and the village, the panchayat, the sarpanch and head, everyone was there. Sir, at that time, I gave them a call. I called them because before me, they have known them since long time, and their relatives also. I made them understood, and along with them, I counseled the patient, which helped him to calm down, stay relaxed, and not to worry about the procedure. And that really helped the patient to carry forward the procedure, sir.
Yes. So tell us about a stressful day and how you manage it. Any stressful day you experience during your job or any during this life?
Yes, sir. Sir, mostly, sir, stressful days were on basically on Mondays. Sir, if on Monday, since the Saturday and Sunday the OPD is closed, sir, so the patient load on Monday is quite high, sir, and all the ANC visits are also there, sir, and along with it, if we have to implement some plan or some drive is going on of PMJ or CARDA, and every drive is there, or if there is a meeting, sir, at that time, sir, I do at morning I see the patients, sir, and when the time, and in the afternoon I give the charge to my junior doctor, the second demo who is there, sir, and I go in the field to do the field work, and all the concerned MPSW and FSW, I talk to them, I take their meeting, and I take updates from them that how much progress have they made. And sir, and in evening there I have meeting at the taluka level in the taluka health office. So that also I attend, sir. And after that, sir, every and end of the day, I take calls from everyone though whom I had given the charge, that if there is any problem, whatever there is problem they had faced, I give them solution for the same.
Yes, so that shows the better management skills in this you. So I would like to introduce a clinical scenario in OPD. So you have to diagnose the patient and advise the treatment. A 10-year-old children come to your OPD with a complaint of generalized itching all over body. and the itching is more severe in the interdigital area around the abdomen and genital areas, and the itching worsen in the night. And there is a mother and father are also complaining of the same type of the itching previously, and patient have a small mosquito bite like small papules in the body. So how do you diagnose this patient, approach this patient, and what counseling, what advice you give to patient and family?
Sir, I would like to ask that should I tell the treatment and approach according to what I had done in my PHC?
Yes, yes, your current OPD practice as per your
Yes, sir.
resources and your availability of the your patient compliance.
Yes, sir. So first of all, I will explain the patient that this is the itching and the rashes, and there is, I will first calm them down that there is nothing to worry about. It will get cured if you take proper medications on time. Sir, I will explain the child's parents that to use separate separate hand washing and everything separate, to keep their clothes separate and to keep the towel separate, everything in the conservative management. Sir, and I will, sir, since the medical resources for the disease is not available, sir, I have Framicidin cream only in my OPD. Sir, I will refer them to a state hospital which is nearby for the treatment to dermatologist, sir.
Yes, your approach is good, but you can also advise some precautionary measure and some working type of the intervention, because the diseases, the scabies, which is highly contagious diseases. So you can advise
Yes, sir.
like regular bathing with warm water, and you can also advise the mass treatment to the family. If they consult with dermatologist, they should treatment everybody, those suffering from the itching, those are the close contact, everybody should take the treatment, because this disease needed to mass treatment. So can you please enlisted some diseases where we required to do community treatment, means mass treatment, patient as well as some contacts or families or the villages?
Sir, in tuberculosis, sir, then leprosy, sir, and if there is a outbreak of cholera, sir, and if there is filariasis, sir, and sir, HIV, uh,
Yes, this
sir, and
diseases.
sir, sexually transmitted diseases, sir, like viral infection like herpes virus.
Yes, the diseases you enlisted that need the prophylactic treatment of the contacts, but in mass
Yes, sir.
treatment we do all the family member treatment, all the
Yes,
rural area treatment, like the worm infestation. If the worm infestation persists, we give albendazole to all the childrens. In this
yes, sir.
scenario, like scabies, we do permethrin application to all the person. So this is a mass treatment. Yes. So describe your steps for treatment of the anaphylaxis.
Sir, in anaphylaxis, sir, first I will resuscitate the patient based on the airway breathing circulation ABCD. Sir, and I will provide, sir, I will check the airway of the patient. Sir, if the patient is, and after, mainly, sir, I will give him adrenaline in dilution of 1 is to 10,000. Sir, and I will give it IV, sir.
Yes. So your first step should be stop the offending factor or drugs. Then
Yes,
managing patient's airway, and further drug of choice management, and other management. So
yes, sir.
at the night 4 p.m., some rural patient come with a case of the snake bite, and they also
Yes,
bring with the killed snake. They also bring with the killed snake, and they are asking you this snake is poisonous or not, and they are also asking that if the snake is not poisonous, then why we should keep in the observation ward under your guidance. such type of the stigma, because the rural patient can try to do some local treatment like some mantras or some tantric activity or some
Yes.
other type of the activity. So how you build the trust about that you have the proper management treatment for this snake bite?
Sir, first I will explain them that if they go to the tantras and tantrics, sir, doing that would do nothing to the physical health. That is not going to solve the problem. I will explain them the pathophysiology of a snake bite, which will help them in better understanding that except observation, how much observationship is important in a snake bite. Sir, and I with the snakes, sir, I will explain them the types of the toxins and the venoms like myotoxins and neurotoxins are there. And if the snake is even non-toxic, so the snake bite can cause several reactions in the body if the due to the bite. I will explain them all those, and for that I will require observationship. I will explain them.
So how you differentiate a poisonous snake from the non-poisonous snake based on the morphology of the snake they bring with the with us killed snake?
Sir, the poisonous and non-poisonous snakes, sir, they are differentiated based on their scaling, sir. The
Hmm.
body scale structure, sir, and their fangs, sir, and the after seeing some snakes are like cobra, sir, we know like viper and all, sir, we know that they are poisonous. On the basis of that, we can directly see and differentiate between the snakes.
Yes. So a patient coming to in your OPD every day and they are asking that they are not getting relief from anywhere. They are having the symptoms, variety of the symptoms. They are not related. They are not related. You will not able to come any final diagnosis. And patient are very much aware, very much worry about their symptoms. So you have suggested that patient should counsel to a psychiatrist, and you suggested a room number in medical college psychiatrist. The patient goes that area and that come to you again your opd and saying that you send it to a pagaloka doctor, you are sended us to pagaloka doctor, and you are saying me as a pagal. So have you handle this situation that patient giving a form of that you refer as a pagal and you are sending as a pagal, but the patient says I am having symptom, I am having problem, you are not able to understood, you are laughing at my problem. So how you handle this scenario of the?
Sir, I will first of all explain the patient that psychiatric department is not just only about pagals. So many patient, normal patients who are not pagal, they also go for counseling. So I will explain them to that. Sir, and I will tell what are the various problems in which normal people also go to a psychiatrist, and that is not something bad. Mental health is as important as physical health. So because we need to stay strong mentally, then only our body will stay strong physically. If I then I will say him that you will get a proper counseling from a trained psychiatrist, which will help you to understand and help you to recover from your problems. And if the society will not treat you as a pagal after that, because the thing is mental illness and physical illness, they both are connected to each other. I will tell the patient that go to a psychiatrist if the some people, anyone, if they are accusing you as pagal, I am there in your village, I will deal with them, I will tell them that, I will explain them and I will counseling them, I am right there, I am standing with you, I will say them that.
Yes, you will. You are explaining in the very better way as a good counselor. So that is really appreciating your approach. But can you please listed the psychiatric services or any national or state program related to psychiatry or mental health that you can implement at your PHC level? Any national or state level program or any type of the helpline number or any type of the teleconsultancy or any type of the health mental health consultancy you can implement at your PHC level.
Yes, sir.
So do you know about any health program related to mental health?
Sir, sir, no, exactly the main problem, sir, which I faced in my PHC, sir, it was regarding the tobacco usage of the people. Sir, I would really love to introduce the tobacco de-addiction program by the government of India, sir, to implement in my PHC, sir.
Yes, you can also implement the telemanas, the teleconsultancy service. Yes.
Yes.
So, some question about the disease management. So, a patient come to you with a positive report of the scrub typhus. So, which medicine you describe in how much doses and how many duration?
Uh,
Laboratory confirmatory report of the scrub typhus.
sorry, sir, I cannot recall right.
Okay. So you have to remember this is doxycycline 100 mg capsule BD. You can consider, or if the pregnancy or lactating woman, you can give the azithromycin, because in this rainy season, scrub typhus cases may be common because the mite is very much common in this area from the kettles or from the uh, small trees. Yes. So what is
Yes.
the full form of the NQAS program?
Sir, National Quality Assessment Survey.
Yes, National Quality Assurance Scheme.
Yes, sir. Scheme. Sorry.
Yes, no, yes. So you have good approach about the proper management and leadership skill, and having a good idea about the public health angle of the management. Yes, now we are coming with our next interview part. So as you doing your already duty in your PHC, so if two of your nursing officer or any other staff is not coming on the time for the duty, and they are arguing very much on the each other, so how you manage this type of the staffs?
Sir, if they are arguing with each other, sir, I will call them together to my cabin. Sir, I will ask them that what is their problems individually, and if they wish to solve them, sir, and if I am able to solve them, then and they are agreeing to work together, then I will be more than happy, sir. And if the problem is such that it is not able to being solved, sir, then I will implement shift-wise duty in which both the nurses will be working at different hours.
Okay. So once you are treating your patient in the OPD, but suddenly you notice a fire incident in your laboratory area. So how you react, which protocol you follow, or if you have a, fire extinguisher, how you use?
Sir, we have been doing fire and safety mock drills. So we have been given training to the medical officer and all the staff by the Jilla. And sir, we have been ensured and we had performed drills at our PHC also. So we will use the fire extinguishers which are installed, sir, and we will close the cut off the power supply which is there, sir, and we will safely through emergency exit. We will evacuate all the patients and all the staff, and we will ensure that the fire doesn't spread with fire extinguishers.
Yes. So there is a protocol like the race and pass, the short form race and the pass. You can read after the interview that are used for the fire management and the extinguisher uses. So in
Yes.
PHC, there must be area for the cold chain for the vaccine management. So in the rural area, sometimes electricity not properly maintained at that area. So how you ensure the cold chain temperature maintenance at your PHC?
Sir, I had personally faced this problem a lot of times in my PHC. Sir, that time, sir, whenever the power supply was cut, sir, I would have kept vaccine carrier boxes were ready, sir, and I shifted the vaccine in those carrier boxes to the CHC Community Health Center, which was nearby me, and they had a proper ice line storage in their uh, hospital, sir, and I shifted all the vaccines there, sir. Then with the power supply returned, sir, I shipped back the vaccines.
Yes. So do you have any cold chain handler in your PHC? And what is the duties of cold chain handler?
No, sir, we don't have cold chain in my PHC. Sir, from the adjacent CHC, sir,
Yes.
we have our vaccine carriers there itself. Sir, and whenever there is Mamta Divas, we take the vaccines from there, and via ambulance we go to the villages in on the
Okay.
Mamta Divas, and we give vaccines and come back.
Yes. So what is the infection control strategy that you are implementing in your PHC for the infection control? How you ensure the proper infection control practices?
So for infection control practices, sir, first of all, we have a technical pest control team, sir, which comes twice a year. I had given them strict instructions to do insecticide and pesticides, whatever the pest control is there. They do that very professionally, sir. And other than that, sir, near the PHC periphery, near the radius, if there is any tree or if there is any stagnant water, store collected water, sir, I clear them. If there is any nearby wells or nearby uh, stored water is there, sir, do proper chlorination of them. And if some trees or bushes and they have grown hugely, sir, and I tell the staff to cut them down and to maintain a proper environment, sir.
Okay, you can also consider the biomedical waste management, the SAP injection practices, also in
Yes, sir.
your PHC. Yes,
Yes,
so
sir.
we are coming in the final part of your interview. So why should we select you over other candidates? What do you think?
Sir, one thing I can promise that, sir, many people have done this. Many people might have been doing this for a long time, sir, but I literally fell in love when I did this duty, sir, and I'm really compassionate about serving those people because it felt like they are my people only. I don't think I will, if I don't get this chance, and if I do any private practice also in city, I don't think, sir, I will get that much of a satisfaction and gratitude at the end of my day. And I think that this duty, I have been made for this duty, and I want to serve those people for the rest of my life, sir. And I will be more than happy with that.
Okay, good. So we are now closing this interview, and now we are proceed with the feedback and area of the improvement. So now we are telling about your area of the improvement. So your pre-interview and first impression part is very good, and in your introduction and self presentation, when you conclude about the your personal information, professional and practical, these are all good. Now communication skill, as you explained the diabetes in the illiterate patient, so you can consider slight pathophysiology in the layman term, like you can say the chemical like hormone, you can say the when you explain the blood pressure, you can use the pipes of the blood in this is such type of the analogy you can use. And in the behavior and situational part, when we ask you about the life saving treatment or management, so you can say any of the your previous experiences during your internship, or when you see any life saving incidents in your casualty that time you can say. So when you answer any question, you can add a example, so this example build the trust on your answer. Yes, so you can give example with each. Now clinical knowledge, you have work on your clinical knowledge, so you have to revise your final year subjects, especially the clinical subjects, like we ask the scrub typhus, we ask the scabies, we ask the some other scenario also, snake bite also. So these are the common. You can also read the IC, the information banner that available in your PHC, or you can also download it from the website. And you can also see from our courses, we have uploaded the STG guidelines and many Gujarat Health Program related guidelines. So that are the common IC material, common banners related to health, that are having the health information. And the interview panel also expecting that basic information about PPH management, snake bite management. Yes, this type of the scenario. So you have just a little focus on the clinical part. Other the public health angle is very good. Now, so national health program, you have also know, also have having the knowledge of the common national health program, like I asked, the program related to mental health, Yes, so examiner can ask any type of the program. They can ask about the IDSP, they can ask about the NCD programs, because NCD are very prevalent, this type of the things. Yes, and then we discuss about the leadership and management. So your performance is very well good about the staff management. And for the legal and ethical patient right, we asking about the emergency patient care, and the fire safety management, because in the national quality assurance scheme there is a provision of the fire safety in the all health facilities. So there is a pass and race, the mechanism is there, how we handle the fire situation, how we use the extinguisher. Yes, so you have to read about this, and along with you have to read about the hand washing steps and chemical spill management in the ward, biomedical segregation, and this type of the things. And finally your last part is also good, that why we choose our other candidates. So we can practice on the further interview sessions with this clinical your knowledge, and you can keep practicing your course by the standard treatment guideline, health program, and etc. Yes, so thanks for the participation.
Thank you, sir.